800-251-1111. Don't settle for less than you deserve.
Welcome back to River City Live. Our friend Dr. O is back, and she has a background in conventional medicine along with integrative medicine. And today we're talking about kind of a complex topic, and that is epigenetics, but it's something that we should all be aware of. Welcome back to River City Live. It's great to see you in person. We've been doing a lot of Zooms together and learning a lot, but it's nice to have you here in the studio. So epigenetics, what exactly is that, and how are we all connected to this topic?
Thank you so much for having me again, Mark. And epigenetics is actually became a personal interest to me, especially after this COVID crisis and what we've been through for the last year. So we've seen different outcomes in different populations, and in spite of they're exposed to the same microbe. I don't want to get in detail in COVID because that's not an area of my expertise. However, when we look at the epigenetics, and everyone has a different blueprint, and then their environment is different. How their genes are expressed from the environment is all regulated by the environmental factors. And Dr. Bruce Lipton calls it protein receptor regulation. And what that exactly means is outcome may change person to person, even though they're exposed to exactly the same thing.
And when you talk about COVID, that's something that's very fascinating, because you'll find out some people have no signs or symptoms whatsoever, and then other people, they're in the ER and are taking a long time to recover, in some cases months afterwards. So what you're saying is it's kind of what's in us, maybe what, part of our genome, our DNA, is that accurate?
So then when we look at the human microbiome project or the human genome project, they're all intertwined, and in our microbiome, especially gut, regulates our immune system. And then other thing is in our micronutrients and in our vitamin D level, our antioxidants, our lifestyle, and it regulates how our genes are expressing. Now in COVID, they're looking certain genes, and then if they have the certain genes up or down regulated, may be changing the outcome for that person. So it's just really, and we can do a lot of things in our environment, change our environment, and we can change the expression of our genes.
So let's talk about that, because that is something we can have control over, our environment. But when it comes to what we're born with, well, that's just kind of what you're dealt. What can we do then with our environment to help us out with this?
And the perfect example for that, you might be born with a gene, make you more prone to develop adult onset type 2 diabetes. But if a person is active in eating well-balanced diet and exercising, and is decreasing their glycemic foods, which is instead of eating white rice, and they're eating maybe brown rice, and they're eating more complex carbs instead of eating more refined carbs, you can downregulate the gene and you will not develop type 2 adult onset diabetes.
Well, that's really interesting. Now, obviously when you're born, you don't come with an owner's manual. So how do you know what you should be doing in order to counteract some of the negative things that we might be born with?
That's a great question. That's actually one of my favorite things to talk about. When patients come in the office, they say, I have diabetes in my family. It's kind of my death sentences. They own it. And then they are okay if they develop adult onset diabetes when they come to their 50s or 60s, and then they're taking medication for it. But there's really nothing in our healthcare system, and we can just put more dollars into prevention. Unfortunately, those patient population needs to be trained early on from childhood, young adulthood. Now we are looking at the markers in our conventional healthcare system to see if they are at risk to develop those conditions. So rather than saying that, like, you've got diabetes gene, we have to see what kind of lifestyle we can actually teach you, so to turn off the gene.
And this really sounds like the basis of integrative medicine, because you're putting the patient in the center of everything. So you're looking at all the factors that surround us, and then from there, you're figuring out a way how to help them out to really just be the healthiest person they could be.
Yes, integrative medicine is highly personalized, patient-centric medicine. So we can actually just look at that individual person, look at their genes, look at their environment, and look at their micronutrients. Then we can actually tweak things much faster than conventional medicine can.
And then who do you recommend integrative medicine to? So right now, let's just say somebody, they're on medications or whatever, well, there might be a way that you could supplement what you're doing, maybe even be off some of those meds if you attack it in a different way, correct?
So this is a great question. I recommend integrative medicine to everyone. And by the time patients have chronic illness, and we end up seeing them in our office because they exhausted their resources to prevention. Now we're trying to turn off their gene to express those genes in a more favorable outcomes. And I recommend parents preconceptually to tap into the integrative medicine micronutrient replacements and look at their environment, decrease their chemicals, toxins, and thoughts and traumas, so then we can actually have perfect manual when the child is born.
And Dr. O, how can people find out more about you?
They can go to our website, drazimir.com or obtainhealth.com, and our pediatric practice is Pediatric Associates Jacksonville. So.
Well, thank you so much. And I always find it fascinating because you do have a background in both conventional medicine, being an MD, but also integrative medicine. So you really understand both sides of it and how it works together. We appreciate all your time and information.
Thank you so much.